This morning we're going to discuss veterans benefits related to VA healthcare and VA disability. We'll be doing this every week, having a different topic. We have the handouts here on the top table identifying exactly what week we'll be speaking on. So help yourselves on that as we go on this morning and as you leave. This morning we also have the other veteran counselors that share their office space with myself. We have Renee Medina, she's my senior counselor. We have Jack Ruark, he is a veterans counselor. And we have Mr. Jeremy Johns in the back, who is also a veterans counselor. We are all veterans ourselves, U.S. Marine, U.S. Coast Guard. Jack's retired gunnery sergeant from the U.S. Marines, and Jeremy Johns was enlisted as well as a commissioned officer in the Army. So these are things that we discuss with families every single day, and that's why we're so passionate about it. There's going to be a day that comes that our families are going to be having the same conversations that we will be having with you today, and also on the scheduled appointments. So we're going to dive right into this. Some of the slides will go pretty quickly, only because there's a lot of information to cover, and we will make sure that you have the opportunity to ask any questions that you have. We have found that there's more information gathered from the question and answer period than obviously from a slideshow. Sound pretty good? Yeah. Outstanding. Who we are, just to identify who we are, of course our names that are there. Manatee County employees, we don't work for the VA, we don't work for the state. We have accreditations with the state. They do a lot of our training. We have access to the VA portholes to look at a veteran's claim, let's say, or speak to the veterans' clinicians at the hospitals, but we're not VA employees. We work for Manatee County. That means your tax dollars actually pays our salaries, okay? Veterans ourselves, and our whole purpose is to assist and advocate for veterans and their families. There are a lot of benefits that veterans just are not aware of, and it's our responsibility here in Manatee County to share that information with you. We are advisors, and as I said before, we're advocates. That means when we close the door, you can tell us just about anything, and we would have to advise you the good, bad, or anything in between of taking that route. Services that we provide, a lot of you in the room may have used our services already, but just to give you a basics of what we do. Obviously, you can read that on your own. I'm not going to read that to you. So as I said earlier, this morning we're going to talk about VA healthcare, how it relates to VA disabilities, but also how it relates to your overall care, okay? We encourage veterans when they come in to see us, this is one of the first benefits that we start talking about, because a lot of veterans just aren't aware that they're eligible for VA healthcare. They may be struggling right now too with the cost of care, but a lot of veterans have access to VA healthcare. So just by a quick show of hands, who's already using VA healthcare? Okay, a couple folks, obviously I am. All right, a couple of folks in here. So you'll probably be able to gain some information from this. That's a picture of the outside portion of the VA clinic that we have here on State Road 64 and Morgan Johnson Road. They moved from Ellington back in January 2010, and they've since expanded their services at this location. It is located directly next door to the Social Security office at the corner of Morgan Johnson and State Road 64 East. That's the new bus stop. We had that put in with the help from Public Works back in 2015. We needed to have some type of a transit drop-off point that was closer to the clinic than the one was on the east side of Morgan Johnson. Veterans had to navigate 4 or 5 lanes of traffic just to get to the VA clinic, and the folks at the transit and Public Works assisted with putting that in for our veterans to be dropped off right in front of the clinic itself. And that's just another photo of it. VA healthcare. The VA is America's largest integrated healthcare system with over 1,700 sites of care. We're very fortunate because we have one here in Bradenton, and we also have an outpatient clinic on Bee Ridge Road down in Sarasota. The VA main facility that a lot of folks in the room are aware of, it's Bay Pines. The name of the hospital itself changed a couple years ago to the C.W. Beal Young VA Medical Center at Bay Pines. And all that really means is Bay Pines is a parent organization for all of the clinics from St. Petersburg down to the Naples area. So if there's ever an issue that the veteran faces and they can't get it resolved at the clinic, we would then escalate it up to Bay Pines so they can work that issue out. Okay? And as I mentioned earlier on, while many veterans qualify for free health care services based on VA compensable service-connected conditions or other special eligibilities, most veterans are required to complete a financial assessment or a means test at the time of enrollment to determine that they qualify for free health care. Now I'm just going to stop here just for a brief moment because it says at the time of enrollment you will have to complete a financial or means test. We actually encourage veterans to do that on an annual basis. The VA about 3-4 years ago stopped sending out notices that the veteran needed to do that. That's because the VA was using income match through Social Security as well as the IRS to verify the veteran's information. But a lot of veterans aren't aware. If their situation changes throughout the year, they need to let the VA know that. It's done annually, but it can really be done anytime that you have a substantial change in your income, family makeup, or the health overall of yourself. Basic enrollment is pretty straightforward. VA healthcare is primarily just for veterans. There are some categories that we have some dependent spouses that get to see the VA, but it's typically when TRICARE or CHAMP VA cannot see a particular individual. But it's primarily for the veteran. So right now it just explains to existing enrollees or eligible for new enrollment if agreed to pay full inpatient or outpatient co-payments. And all that really means is when you do the means test, there's a cutoff for income. All right, so a veteran without any dependents, after medical deductions, you have to earn $40,370 or under in order to get in. All right, that's just basic off the top. If you have a veteran with one dependent, same type of scenario, but then the income cutoff is at $46,145. Now the thing to mention about both these categories is based on the last calendar year's income. So one of the things that the VA talks to us about, the best time to do that means test is around this time of year when a person's doing their taxes, because you have your W-2s, you have your 1099s, 1098s, and all the other tax statements to file your income taxes to include any medical care that you paid for out of pocket. That is used to reduce your gross dollar amount to under one of these categories. Okay? Enhanced eligibility, we have veterans that have service-related disabilities. We also have veterans who served in Vietnam and other areas that Agent Orange was used. You have current veterans coming out of a combat zone over the last 5 years. And also our veterans who served aboard Marine Corps Base Camp Lejeune and its other surrounding bases. But this is a breakdown of all these special categories, regardless of a person's income, that if you fall in one of these areas, income is not an issue at all. They encourage you to still fill out the means test because, say for instance, you have a veteran that has a 10% disability. Well, the VA is going to treat that veteran for everything that's wrong with him, but they're going to charge them a fee for anything that's not service connected. So if they know what your income level is, that would tell the VA if there will be a copay at all, and if so, what that amount would be. Okay? So that's just another question that we can assist you with in the office. Primarily, we prefer if you go out to the VA clinic and let them do that. But if you're already in our office talking about something else, we can assist the veteran and their families with that as well. Okay? Type of services provided at the outpatient clinic, pretty straightforward. It's like any other clinic. They've expanded, like I said, from 2010 till now of the services. So they do have some imaging. They have pharmacy consultation, social work, and then, of course, you have the lab draws, flu shots, things like that. Okay, pretty much it's a full service type of a deal. Now, last year, the VA came out and said that they're going to run a test on all the outpatient clinics to see if they can operate as a walk-in. We are very fortunate. All the clinics within the Bay Pines catchment area are now considered walk-in clinics. So what that means is you don't have to wait on a scheduled appointment to see your doctor. Now, you may have to wait in line 30 minutes or so to see someone, but you can go to the VA outpatient clinic that you're assigned as a walk-in and be seen. Okay? This is just a rendering of the VA ID card. Everyone who's enrolled in the VA healthcare system, they have this. It just outlines their number as it is listed in the VA healthcare system, what plan they're under, the branch of service, and then, of course, the beautiful picture. Yes, sir?
Is there a new VA ID card that works? Because I've seen postings.
The veteran had a question as far as, is there a new VA ID card that's supposed to be out and about? Well, in November last year, we finally got this thing on the ground running. It took about 2.5 years. Veterans who just say for instance, they were not enrolled in the VA healthcare system, really had no way of identifying themselves as veterans unless they carried a copy of their DD-214 around, or they're a military retiree, or 100% permanently disabled veteran, you had no other ID card. Now, there are several states in Northeast United States and a couple of Midwest that actually issue state veteran ID cards. The state of Florida, however, only has a V on your driver's license. So when Congress passed that bill last year and made it come to action in November, the VA was to then take the veteran, an honorably discharged veteran, whether it be active duty, National Guard, or reserve, take their information, verify that they served honorably. The veteran would have to supply the photo, and they're looking at two photos of identification, would be passport size, and they would actually ship out the veteran a regular ID card. But here's the hiccup. The card doesn't allow you to do anything related to VA care. It just identifies you as a veteran, okay? And a lot of this came about, we all know that Lowe's and Home Depot and other companies throughout the nation offer discounts to veterans, but there was really no way to identify. So once they really get the bugs fixed out of this type of a deal, any veteran who may not be enrolled already in the VA healthcare system can get the standard just veterans ID card. If you're already in the VA healthcare system, you won't need to do that. Exactly. So that answer your question?
Yeah.
Perfect. Pretty straightforward. Outpatient services, as I mentioned before, the VA does have a co-payment for certain services. Right now, if it's just for basic care, and that's, scheduled primary care and follow-ups, it's a $15 copay, unless that is waived because of your category. If a veteran is seeing a specialist, such as cardiology, those types of things, neurology, there's a $50 copay. But here's the thing that I like about it. Let's say you go up to Bay Pines, you have 3 or 4 appointments in one day. Whatever your highest copayment is, that's what you're going to pay for that visit of that day. Okay, so if you see 4 folks, you're only going to be charged $50. All right? Thing to remember though, if you are service connected for a particular disability, let's say our Vietnam veterans who now have heart disease, and they see a cardiologist, they wouldn't be paying that anyway. Okay, because it's a service connected disability. Also, those veterans who have a service disability of 50% or higher, they also don't pay any copays. These copays are usually for those veterans that have a low level of disability or who barely got under the wire with their income. But you already know what the copays are going to be before you even get to the VA. Okay? Next, inpatient services. Again, pretty straightforward. The veteran's income allows them to get into the system. These are the copays for inpatient long-term care in the hospital or the domiciliary. Okay? And all these slides can be provided to you via email if you need. I just didn't want to print them out. There's a lot of information. Additional, again, priority group 8, for those veterans that are unsure what that is, priority group 8 is really the lowest level of enrollment. You barely got in because of your income. There are no service waivers that allow you to come in. Based on your income alone, you got under it, and you've been active ever since 2003. These are your co-payments for inpatient care. Okay? Medication's pretty straightforward. For years, the VA had a set dollar amount for any prescription, anywhere between $8 and $9 for a 30-day prescription. They since changed that. I want to say it was summer of last year. It's February actually. That they now have tiered medications. Tier 1 is preferred generics. A lot of us use generics now. Publix does them. Non-preferred generics, pretty straightforward. Some over-the-counter meds have this copayment for a 30-day. And then, of course, if you have brand names and the VA carries that brand name, for a 30-day supply, it's $11. Okay? But keep in mind, again, if you are a veteran with a disability, whatever medications the VA prescribes you, there's no copay. And also, if you're in priority group 1, you pay no copays at all, as you see mentioned here at the top. Those are those veterans that have a 50% or higher disability rate. All right, the VA Choice Program. 2014, 2015, the VA was in the news just about every day about veterans' wait times, what were we going to do to resolve that. The Choice Program in 90 days came out of Congress, passed, everyone was signed into law, but there are a few hiccups. So we're going to try to explain some of those hiccups for you and how you can get around them. Eligibility, pretty straightforward. Choice Program is used for any veteran that cannot be seen within 30 days or if they live more than 40 miles from a VA facility. And I'm going to stress a VA facility here in just a moment. Okay? So the 40 miles has to do with the closest VA healthcare facility. So if we live here in Bradenton, a veteran needs to see a specialist, let's say, that's in Bay Pines or otherwise, and the veteran says, well, I'm outside of a 40-mile radius. Well, unfortunately, you're not, because we have a clinic here in Bradenton. The current law is written that if you're within 40 miles of any VA facility, you would not qualify for the choice program based on the mileage. Okay? We would then take a look at when the VA was going to schedule that veteran. If it's outside of 30 days, the veteran would fall under that category. Okay? But they're still trying to tweak this whole 40-mile radius, because if you need to see, let's say, a true specialist in things, and they don't offer it here in Bradenton, well, I can't get the services here, so I need to be choiced out, or you have to drive up to Bay Pines. So they're still trying to figure out what they're going to do with that. Okay? This just gives you a breakdown. Veterans who are eligible based on their place of residence will be eligible for the use of the choice program for any services that are clinically necessary. So that means if a veteran's outside of the 40-mile radius, any health care that they need, if they choose not to wait on the VA to be seen, they can be choiced out for everything that they see the VA for. Okay? So those are those folks in the middle of rural America that have no VA facilities within a 40-mile radius. Okay? The veterans who are eligible because of the wait time, however, will only be available to receive non-VA appointment for that particular episode of care related to the service that cannot be scheduled within 30 days from their preferred date or the date medically determined by their physician. So again, for me, I think it was November, I had an issue with my eyes. I needed to get someone to do an exam for me. They could not see me until like February, okay, unless I went up to Bay Pines as a walk-in. Well, that was well outside the 30-day period. They choiced it out. I saw a local optician, got squared away, rock and roll. Okay? But just keep in mind, if you're eligible for the choice based on the 30-day criteria, it's only for that episode of care. So if you need to see a cardiologist, you see a cardiologist through the choice program, you get that issue resolved, now you're back into the VA healthcare system. I've already explained this. Does the VA 40-mile rule refer to whether the specialty need, for example, orthopedic surgery, is available within 40 miles or 40 miles from any VA facility, whether or not the specialty, in this example, orthopedics, is available there or not? Again, current law is very clear, straightforward. Does not matter if you are able to get the care at the local clinic, but you're still within a 40-mile radius of the local clinic. All right, again, anyone that's in the healthcare system, you know this, cost sharing. The VA may not necessarily charge a veteran a copay, but they may reach out to that veteran's private healthcare plan to be reimbursed some of those costs. All right, service disabilities. Yes, sir.
Can a veteran get a review, like of the year of care that was, as to what was billed out to the Medicare and other job-related medical coverage?
Yes, so the gentleman asked the question, can a veteran get a printout of what may have been charged to their private care? You would normally already get that from your private insurance company, explanation of benefits form, but yes, you can also request that from Bay Pines. They will get you a printout of what they sent to your private healthcare provider, private health insurance provider, and what they were paid in relation to that.
That can be done, it's building 100, I guess?
Yeah, exactly, the main campus. But here's the thing with that. What's good about the VA policy with trying to bill your insurance, if the insurance says, well, we're not going to pay it, it still doesn't come back on the veteran. The VA has to at least attempt to recoup some of the money. That's how they keep things going. Okay. Any other questions, gentlemen, ladies? Okay. Rocking and rolling, going on to service disabilities. I would say there's about, what, 45, maybe 50 disability individuals. And I say that mainly because we still have some World War II veterans who are around. They're surviving dependents. Of course, our Korean War and Vietnam veterans, they're up in age now, so the other 50% would be related to the pension program that we'll be talking about next week. So let me just go ahead and break down service disabilities. What are they and how do you apply? I'll give you a minute or two to read that. I'm only going to read that to you. pretty much in a nutshell, it just says you need to have 3 things in order to be successful when filing a disability claim. Okay? Biggest one that we're seeing when it becomes the denials, there's no diagnosis. Okay? We have to be able to put something down on paper or what the veteran is filing for disability. All right, so break all those 3 categories down. Military service caused a condition or made a pre-existing condition permanently worse. All right, give you some examples here. Herniated disc resulting from numerous jumps in airborne school and beyond, obviously, because once you go through airborne, you're jumping more often. That's going to cause you some issues with your back, your hips, your feet, your knees, and even some traumatic brain injuries, slamming it into the ground. That is a condition that more than likely was caused by the military. Okay, so as long as it's been clinically diagnosed, we more than likely be able to file a claim for that. Hearing loss, same thing. Hearing loss or tinnitus, which is that ringing, humming, buzzing noise that some folks have in their ears. After 4 years service as an artillery crewman, and there's no history of a post-service acoustic trauma, meaning that after the veteran was discharged, there was nothing else in their background that would have exposed them to the same acoustic trauma as it would have been in artillery. Okay? Yes, sir.
Yeah. I gotta say, I just got approved for disability for 1 year of unforgettable artillery service as a medic in Vietnam. But so the 4 years of service may not be like a minimum requirement.
No, that's just an example. Yeah, that's just an example. And it's good to know that because everyone's disability claim is going to look totally different. You and I may have served together doing the exact same thing. My claim would not look like yours. But it's good to note that. All right, and you know, also if you look at the bottom, I had to put this in here because you're seeing more and more of this come across our desk. Veterans who've been diagnosed with, you know, herpes, HIV, or anything else sexually related, you know, those types of things can be service-related disabilities. Okay. Presumptive conditions. I mentioned our Vietnam veterans a couple times now, but now that we have the exposure of the contaminated water at Marine Corps Base Camp Lejeune, these are presumptive disabilities. And what that really means is the one component to prove that the service would have caused an issue goes away because the VA and the Public Health Administration has already determined that if a veteran that served in any of these special category areas, if they're ever diagnosed with these conditions, that piece of it is gone. It now becomes a presumptive condition. So if it's been diagnosed, we can prove that the veteran served in any of these areas, it now becomes a disability based on its severity. Okay, and there's a laundry list for both these categories. But I want to share something with you. I didn't put a highlight on this, but if you look at number 3, Lou Gehrig's disease, or ALS. Any military veteran serving at least 90 days on active service, if you get diagnosed with ALS, it is a 100% disability benefit for the remainder of your life. There is no cure for that. The study came out, I want to say about 5-6 years ago, that there was a higher percentage of veterans being diagnosed with ALS than it was any other segment of the population. Okay? I've yet to figure out why that was. I haven't sat down and read the entire regulation manual on that, but it's rather shocking to hear that, you know, knowing that that's not a curable disease. Okay? This is also important to note too, if you're aware of any family members or friends that may have passed away from ALS and they served, their surviving spouses are now eligible for benefits as well. And they'll talk about more of that later this month, but we come across surviving spouses or surviving dependents of these veterans who have since passed away. We're now having to go back in, look at the death certificate, and then file a claim for those individuals. Heart disease is a big one because it didn't really come out until 2005, I want to say, before they start ramping it up. 2010 when it became active again. All right, so just keep that in your memory bank that if you come across any surviving spouses or surviving dependents whose parent served in the military and died from any of these scenarios, at least have them give us a call. Okay. Pre-existing condition is made permanently worse. What does that really mean? Well, you had a right knee injury from high school. After 2 years, infantry now requires surgery and full knee replacement. Pretty much the rigors of active duty made that condition worse. Okay, it's going to happen. bone spurs in your feet resulting from flat feet, and your true of active duty and combat boots, so on and so on. It just makes that condition worse. Okay? So those are just some examples of that. Secondary conditions. Now, we see a lot of folks in our office that come in that may have back injuries, they have some knee injuries, or a multitude of other things structurally with their body. Normally, if you get bad knees, you're going to end up having bad hips. If you have bad hips, you're going to end up having back problems. All those things go hand in hand if your orthopedic specialist can outline where the cause started. Okay? We know doing this every day you're going to have those problems. Also, being veterans ourselves, and let's just say the infantry, we know the feet are bad, the knees are bad, the hips are bad, the backs are bad. Everything's jacked up on you. You're not in alignment. So, but in order to get that service connected, we need to put all the pieces together. We just can't jump out there and say it's my belief. We're not clinicians. We're not properly trained in those areas to give you a diagnosis, but we can definitely help you put those pieces together. And it's just important to note, I mean, you have to really pay attention to your body so that we can get all these things documented the first time around instead of going to the well 5 and 6 times. Okay, we have some veterans that do it every other month. They're filing a different one. You know, we don't want to do that because the more times the file is looked at, it may open up something that you may not be eligible for, and now you lose some benefits. Okay? Drc Protocol, I want to spend some time on this because this is the way that the VA is going. DRC means Decision Ready Claims. What that means is we as your counselors, as your advocates, and you the veteran are going to spend more time developing your claim before we send it to the VA. And what does that mean? Just a fast turnaround. Okay? You can read that for a couple seconds. Pretty much what I said already, but it's came out, what was it, Renee? We actually started hitting the ground this was December, November time
November,
frame?
yeah, November last year.
Yeah, they talked about it for the longest of time, and late fall last year it came out that this was going forward. We've used it a couple times. It works when it wants to work. Got some hiccup, but we're still working through it. Pros, very straightforward. Fast response with an answer within 30 days. Okay? If it goes through, you're seeing the 30-day turnaround, maybe 40 days, but normally about 30 days. Downside, more work is expected of the veteran and the service counsel because we now have to make sure it's diagnosed. We have to make sure that the medical evidence is a part of the file. We have to do everything up front in a very specific order, as it says here. No wiggle room on the evidence required and very strict submission guidelines. It's a step-by-step process. It does work, but we have to remember our responsibilities as your counselor, we have to slow the process down and just think about what we're getting done. Because once the horse is out of the barn, well, it's already out there now, okay? This is just a flow chart of what it looks like. We as your counselors have to sit down with you and go over these different scenarios and different options that we have. Pretty straightforward, I'll go through these pretty quickly. Veteran and the counselor discusses the contentions, okay, what seems to be the problem. The counselor submits what's called an informal claim or an intent to file, which just pretty much puts a place marker in for that particular month of benefits, along with the VA Form 2122. That particular document is just identifying our office as well as a national veteran organization such as the American Legion, the VFW, DAV, and several others that identify that we will be the veterans representative going forward. So we get to look at everything that gets submitted, and we also play a part in resolving any issues that come down the pipe. Okay? If the records for the veteran are not visible already, we as your counselors, we would send an email to the VA and have that veteran's paper file digitized into the VBMS system. Okay? That's the Veterans Benefit Management System. The VA went paperless a couple years ago, and this is the database that they use. It all gets scanned in by a private party, and then we log on, put your social or your claim number in, and it pops up with all your documents through your service records and anything else that you may have submitted over the years. Once the records are visible in the VBMS database, the counselor sends in a request for the appropriate exams or gathers private medical evidence that is equal in weight to the VA exam. So let's just say we have a veteran who wants to put in a claim for an increase to the back condition. They have not seen the VA related to any of that. They have been seeing outside doctors for it all. We instruct the veteran on how to approach that doctor, get their records, get them to fill out what's called a disability benefits questionnaire. It just pretty much takes everything out of your record, put it onto a 2 to 3 page document. It takes the place of a VA examination. So once we do that, we move on to the next. But here it is. If the veteran's records are currently visible in the VA database, the counselor orders the specific exams for the contentions, or again, gathers the private medical evidence that is equal in weight to the VA. Once all of those steps have been done, depending on where you fall, the exams have now been returned if the veteran went to a VA exam, and they're now visible. That's the key. They have to be visible in that database, because a lot of VA workers now work from home remotely. They log in, they see the exams are back, they see all the evidence is there. Now they can move on to adjudicating the claim. Once they're visible, the counselor actually then submits the remaining package that is signed by the veteran. Only the veteran can sign the application, and they await a determination. Okay, so it's pretty much in a reverse way. Other typical claims, you submit the application with requests to pull records from your doctor, schedule exams, so on and so forth, and then once that is all back, they make a decision. This way we start just putting in a notice that we're going to be filing a claim, gather all the things that we need, and then lastly send in the actual application for benefits. Okay? 30 days, you know, it still may take a 4 to 6 month time gathering everything, but that we know when we submit it to the VA, we'll get an answer for that veteran within 30 days or so. All right. Key component to any disability claim. We talked about the service causing an issue or making one you had prior worse. The next thing that was on that bullet page was it has to be medically diagnosed. Okay? We can't file a claim for back pain because it's just back pain. What is causing the pain? Is it a herniated disc? You know, is it something out of alignment? What's really going on with that actual individual? So at the very top, a medical diagnosis is just that, a diagnosis from a medical professional in the field of said condition. You can't see a gynecologist for a hearing exam, okay? Pretty straightforward, right? You see a cardiologist for heart disease, post-traumatic stress, you would need to see a clinical psychologist or psychiatrist to be diagnosed, because pain alone is not a disability. There must be a medical term that is being claimed. For example, a herniated L4, L5 disc versus filing a claim for low back pain. Okay? Everyone's following what I'm saying, right? We talked about the benefits questionnaire. It's wise to use this form because it outlines the same questions a VA examiner would ask a veteran in an exam. Point by point by point. The veteran's name, their social, what's the diagnostic code that they've been diagnosed with, what was the treatment plan, what are the residual issues. So it answers all those things on those forms, so the veteran, once they turn that in, they know for sure all the criteria has been met. The doctor signed it, the doctors put their medical number as well. You've got to verify that they're an actual doctor, of course, and along with their contact information. Okay? At the bottom, certain Desert Storm veterans. I mean, a lot of veterans who served in Desert Storm and Desert Shield, they get forgotten because that war has been ongoing ever since 1990. We're still in it now, just in a different area. But those veterans that have chronic symptoms that cannot be diagnosed, let's say fatigue, headaches, and they can't really pinpoint what caused it. If you served in Desert Storm, Desert Shield, there's also service connection related to that. Okay? The key component of that is being chronic over a long period of time. Okay? Medical nexus, that was the third bullet on that first slide for disability. We have a disability that we know that was linked to service. We have a diagnosis. But the thing is, the veteran's been out in the military for 10 years now. We don't know what the veteran's been getting into. We don't know if they got hit by a truck 5 years ago or whatever they may have done. So we need a medical nexus. And it's important to note that any disability that the veteran is diagnosed with within 1 year of discharge is related to service. The VA would consider that as service-related disability. Now, all of us in the room are going to assume we've been out of the service for more than 1 year. So we would fall in this definite category, of needing a medical nexus. Pretty straightforward. What is that? A medical nexus is a medical opinion based on the current diagnosis and a link to military service. So pretty much just saying those first two things that you need to have are linked together somehow. The opinion does not have to be 100% in the veteran's favor. We just need 51%. Okay? Even if it's 50-50, if that doctor has used documented, peer-reviewed medical evidence along with their medical opinion, even if it's 50-50, tie goes to the veteran. Okay? Now, a lay statement from your spouse or your buddy that served with you is not really going to get you at 50-50. It can help. You really need to have a medical opinion. So as we go down, bullet number 2 clearly outlines what do you mean by that. A clinician should be reviewing the veteran's military service treatment records as this puts them on equal footing as a VA examiner. Now, of course, we had a fire in '73, so anyone that served prior to 1973 may have had some damage done to their records. But going forward, half of us in this room have served after '73. So we either have a copy of our service treatment records or we can order them and they're readily available to have. So before you go out and see your private physicians for any disability that you want to file, you need to make sure that you have a copy of your service document so that the doctors can look at those things and give a well-grounded medical opinion. Okay? If you don't have them, it's our responsibility again to request those documents from St. Louis for you, whether it be electronically or on the hard document of the SF-180 form. It just outlines who the veteran is, when they served, branch of service, and what do you need from them. You can request copies of your DD-214s, your full medical records, your full personnel file, anything that the National Records Archives has of record, you can request that at no cost. Okay? When available, the clinician should cite reviewed or credible medical literature used to strengthen their rationale. We just can't pull a rationale out of the air. We want to see the doctor reference something of credibility. Okay? Mayo Clinic that's dealing with cancers and those other serious diseases. Those are the types of documents that the VA wants to see the doctor state because it has a little more weight than just saying, okay, we feel this disability is service connected. Very bottom, buddy or lay statements can be used to substantiate a claim in the absence of military records. Think about continuity of care. So let's just say we have a veteran who served 4 or 5 years on active duty. They get out of the service, they get married, and they've always had a problem with their back, but being stubborn as we are, we don't get it looked at for 15, 20 years. Okay? Now that spouse is seeing that veteran suffer the entire time. So that buddy or lay statement can help bridge the gap of the lack of medical evidence. Okay? Well, let's say for instance, you got out of the service and you've been seeing a doctor for that back injury ever since then, and you wait 10 years to still file it. We can go back to those records and it will show that the veteran within that 1 year of service discharge, had medical care from that point going forward. That shows the VA, yes, the veteran did have a condition and it is more than likely related to their service. Okay? I say stubborn because we all know, veterans, we all stubborn. Doesn't matter what branch of service. Marines are a little bit harder, yeah, I gotta know that. But, I mean, just being who we are, we put one foot in front of the other and we keep moving on. As we get older and life starts to slow down, oh, now I'm paying attention to my knees, I'm paying attention to my back. My spouse has been complaining for years that I turn the TV up to 15 when it's normally at 3. Those types of things. We now have the opportunity to get a veteran service connected for those disabilities. This is just a photo of the Nexus form. I think we have some up front. If you folks are considering filing a claim, it's been some time since service. We have a copy of the Nexus Statement out front here so you can grab it. It just outlines all the things the doctor has used to come to a medical opinion. Have they looked at your service treatment records? Well, we already know they're your treating physician, but have they looked at anything else? What's the claim condition? Is herniated disc? Is it migraines? Is it post-traumatic stress? What is it that we're thinking the veteran wants to file a claim for? Okay? What's the veteran's contentions? Well, if it's back, hips, and knees, it's the rigors of active duty in this unit, whatever it may have been, has caused my body to ache where it's aching. And then the doctor just goes down and makes a few check marks. What's the likelihood? 100%? 51%? 50-50? Or not so much? These last two aren't going to do us any good. Okay? Unless the evidence that you're presenting is exactly the same as what the VA has, 50% and under is not going to help the veteran. Okay? Yes, sir?
Yeah, just getting back to the body.
Credentials are available. All right? So that's what you're looking for when you're talking about a medical nexus statement. What about 100% ratings? Or, temporary, permanent, and total, which is PNT, you hear the term all the time. This is just an example of all the different types of a veteran being 100% disabled through the VA. Okay, I am going to read all these because they're very important. 100% ratings can come in many different forms. For example, noted earlier, convalescent. And I think we actually skipped across that slide. Convalescent just means that a veteran has, let's say for instance, a back injury that's service connected. They go in and have a surgery on their back. If it's 21 days or greater, the veteran is rated at 100% for that particular month. Okay? We see a lot when it comes to knee replacement, hip replacements. If it's out at least 21 days that the veteran is out, the VA can pay that veteran at the 100% rate while they convalesce. Okay? Temporary 100%, schedule rating while undergoing treatment such as chemotherapy, the exact same thing. Veterans, mainly it's those veterans we're seeing now of Agent Orange exposure, while they're going through chemotherapy, the VA is rating them at 100%. Okay? They're also rating them what's called housebound, because when you go through those types of treatments, your body is weak and you need someone caring for you. So there's additional money that's added on top of that. But that's the temporary scheduling. Or the sum total and severity of a veteran's disability add up to be 100%. Now that doesn't mean you have 50% for post-traumatic stress and you have 50% for your back. They don't add them together. It would be 50% for post-traumatic stress and 50% of what's left from the previous rating. All right? So 50% of 50% is 25. 25 plus 50 is 75, rounded up to be 8. Okay? If anyone has more than one disability rating, you already know what I mean by that. You just don't take the totals and add them up. It's based on the severity overall of how you get to 100%. All right? Permanent and total. When the severity of a veteran's disabilities are so severe, they are not likely to improve. And it's very unfortunate you have a lot of veterans walking amongst us who are rated at 100% permanently and totally. Okay? No likelihood of getting better. Some time to time you'll get vets in, well, I want to be 100% for my diabetes. No, you really don't. Because that means you're in bad shape. So, we try to make sure that veterans understand the whole goal of being disabled and going through treatments is to one day maybe get back to 100% or as close to it as you can, but there are some times you just can't do that. You have veterans in our community that are 100% related for their hearing loss. They have no hearing whatsoever. Okay? Or you have veterans who are permanently disabled because of loss of limbs. Those are things that, those veterans will never be able to truly rehabilitate from. They can still be independent, but their appendages are not going to grow back. Okay? What about individual unemployability, or IU? Okay? IU just stands for just that, individual unemployability. In a nutshell, it says that the veteran's service-connected disabilities are the reasons why the veteran is unable to attain gainful employment. Okay? We can't have a veteran get fired because they didn't show up on time or they're just nasty in the workplace if they didn't have any post-traumatic stress or any issue that would have made them do those things. But if a veteran, let's say, was diagnosed with post-traumatic stress, anxiety, depression, anger outbursts, whatever it is, and that's the reason it shows in their HR file, more than likely we could show that that veteran has a huge hurdle for securing gainful employment. Okay? This is really not the place you want to be. Primarily because, one, annually they get to ask you, have you been working? But there's normally some type of room for improvement depending on what that hurdle is. If a person can have, let's say, counseling for their post-traumatic stress, and now they can have gainful employment, they're no longer going to be 100%, which is fine. We want them to get closer to 100% on the healthy side. But I'll read the definition. IU is a form of 100% disability based on the fact that your service-connected disabilities pose a substantial barrier to gainful employment, which is considered anything over the poverty level, which is right now about 11,000. So let's just say a veteran's so disabled that they can't secure gainful employment. Yeah, they have a part-time job here or there, but it's working out of their home, working in the evening, they don't have a lot of contact with folks, and you're not making a lot of money, you can still be considered for this particular program, okay? This form of disability can be considered permanent and total. However, usually if so, the veteran's disabilities themselves have increased in severity. So the first thing that we're going to take a look at, can we get the veteran's service-related disabilities increased so that that veteran can be rated at 100% versus having this hanging over their head, okay? So typically when a veteran's not able to secure gainful employment, we want to take a look at the veteran's disabilities first and then add on the IU at the end so that they then have to look at the entire picture, okay? All in bold at the bottom, very important. If not for yourselves, there's somebody in your life who believes their rating is permanent and total. No rating is ever truly considered permanent and total until you have reached the 10 and 20 rule. Okay, so what is that? The 10 and 20 rule. In a nutshell, if a disability has been rated for 10 years or more, the veteran does not lose the disability, which means, let's say you're 10% for migraines ever since the 80s. Well, it's past 10 years, so you will always have a disability related to migraines. Well, if you've had that disability for 20 years, you can never be dropped monetarily either. Okay, so those two things will come into play depending on where you fall. If you've had it for 10 years, you'll always keep that rating. If you've had it for 20 years, you'll always keep the dollar amount. Now, however, both have provisions to sever that disability and its ratings if found to be granted through fraud. That's pretty straightforward, right? So you have a veteran who doctored up some records from their physician because they couldn't get the doctor to sign off on them, submitted it to the VA, they were granted the benefit, the VA does an IG report and finds out that the veteran actually doctored those forms. They're going to sever all these and more than likely bar that veteran from any benefits going forward. Okay? Don't see it that often, but they're out there. Voc Rehab, Vocational Rehabilitation. I like this program, but it's clear to note, if you want to read that first bullet with me, vocational rehabilitation is an employment empowerment resource. It is not an education benefit. Voc Rehab is a disability benefit provision that allows for formal retraining for a veteran that has a disability rating of 20% or more, and that disability poses a substantial barrier to gainful employment. Somewhat similar to the individual unemployability, but you just say, for instance, you have a veteran that is 30% service-connected for anxiety. They're not able to work around people. They've only been trained in an area of a skill level to be around people, but they can no longer do that because of their disability. We would then submit an application to the Voc Rehab folks who are down in Sarasota. They'd bring you in, they'd do an evaluation and an assessment to see exactly if you fit the models and what you would actually be good at if you were going to go through this program to be retrained. They would then make a determination, yes or no. If it's granted, this program is similar to most education benefits within the VA, but the one thing I like about the Voc Rehab, you have a counselor that does just about everything with you. Someone that sits down with you, looks you in the face and says, well, the test says you would be good in these areas. Which of those areas do you want to go for? I had a young lady, she is 100% for post-traumatic stress, anxiety, depression, and she was wanting to become a doctor. Well, she didn't do too good in college. She needed tutors, and you can't go through medical school with a tutor, at least the doctor I want to be seen by anyway. You know, so just being honest with that veteran saying, well, the options that you're choosing to become a doctor, I'm not saying you cannot do those things, but it may not be the best thing for you right now, okay? That's the thing I like about the Voc Rehab counselors. They are pretty much your conscience to say, yes, based on what we know about you, you would be successful in these areas. Based on the economy, these are the other things that you may be successful in. You know, not everybody's going to be able to choose a job right off the bat of what's going to be successful. Their role at Voc Rehab is just not to retrain you in anything you want to do. They want to retrain you in something that you will be able to have gainful employment. Whether it be self-employment or otherwise, that is their whole goal. The other provision I like about this benefit is that anything that the veteran needs to be successful, whether it be a laptop, special equipment, dental. Dental is now a benefit of the Voc Rehab. Anything that is going to allow that veteran to be successful in the job market is provided under the Voc Rehab program. Whereas with the post 9/11 GI Bill and even the GI Bill now for life, you don't have that. Dental is a benefit that's only for 100% disabled veterans or those veterans that have mouth trauma while in service. But Voc Rehab, you can also receive dental as well. Yes, sir.
If somebody has somehow soldiered through a working lifetime, made it to Social Security, retirement, but wants to do self-employed, and can they avail of a Voc Rehab program?
Yes, there is no age requirement to apply for Voc Rehab. A lot of veterans say, well, I've worked for so many years, I have a pension, but I'm still wanting to do some things, but I'm 70. Will I get denied based on my age? No, there's no age requirement. We still have to show that your disabilities are the reason you can't work. Okay? That is really the only piece that you have to overcome. All right? Some veterans can be considered for Voc Rehab at 10%, but the threshold of a substantial bar is so high, they should first consider a claim for increase. Similar to what we talked about with the individual unemployability. If a veteran's at 10%, that's not saying they can't apply because it's a 20% minimum. It just says, hey, if you truly think there's a bar to your ability to have gainful employment, let's look at this first, because if we can get you up to 50%, you know, that gives you more an opportunity to be enrolled in this program and also opens the doors for other things that you weren't able to do at 10%. All right, but a great benefit in those two components of having a counselor with you the entire walk of the way and the VA providing the additional benefits such as dental, equipment to be successful, those types of things, to include the housing stipend. I mean, it's a great program if you can fit into it. Increases. So a veteran wants to file for an increase. You folks can read this, pretty straightforward, because the VA will always take the veteran's word that the disability has gotten worse. We still have to prove that they have gotten worse. Okay? Pretty straightforward. The thing that I like about the VA and its ratings, and you guys in the back can attest to this, when the VA gives you a decision and it's right, they also tell you why they didn't give you another disability. We granted you 20% for this condition because of X, Y, and Z. In order to have a 40% rating, these are the things that you need to have. So we in the office, that's where we start. You want to file for an increase for post-traumatic stress or coronary artery disease? That's fine. Do you have these conditions? No, I don't. Well, why are we filing a claim for it if we don't have these conditions? You know what I mean? So we have to be mindful of that. You just don't want to do an application and submit it. We have to make sure the medical evidence is there. Okay? Unless there's been a gross error in your initial rating, and we do see that unfortunately from time to time, avoid asking for an increase every few months. We have some veterans that have filed claims on 30 different issues all at one time. 30. We have to sit down and figure out what do you really have a diagnosis for and what we don't, and just move those to the side for later on. And that's our whole role. Like I said, we have to tell you the good and the bad of what you're wanting to get done. Because someone who's filing a claim for 30 different contentions really isn't helping any of us in the room. We have claims, other veterans have claims that are just stuck behind that one. You know, we need to figure that one out and make it a little bit easier for the VA to make a decision. Okay? At the bottom, again, not to scare any veteran, but when filing for an increase, all other conditions can be reviewed and either increased or several cases decreased if there is evidence shown of improvement. Okay? Again, that's the whole thing about that rating decision. It tells you why they gave you the 10% and what you have to get to 20 or the 30. If that medical evidence showing that you've actually gotten better, well, you went in for an increase, now you're at a 0. So, I mean, you have to just think about it and take the advice of the folks that do it every day. Not saying that we're always right, but we have a better understanding of the programs than the average person. Appeals. The appeals process is going through some revamping now, so I'm going to go through these slides pretty quickly because it's a lot of information to cover, and we may have to do it on a single day. But an appeal, you can see it at the top, 2 to 5 years from the beginning to end from this point. An appeal is just that. A veteran gets a rating that they don't like because it was denied or it came at a rating lower than they expected. So the veteran can file an appeal. The first part of that is a notice of disagreement, just telling the VA that, hey, I disagree with what you've given me and here's why. Please look at it again. Okay? A formal appeal is after they've looked at the notice of disagreement and says, well, we still keep the denial in place. Do you want somebody else to look at it in DC? That's the formal appeal. As you see here, these are very strict guidelines. They're going away under the new provisions, but I put them there so that you can understand that the folks who are currently in the appeals pipeline, these are the things they had to overcome. Okay? Here's the reason why I don't want to spend a lot of time today on it, because this is the current process for appeals. As you can see, we start working on a claim here. These are all the things that needs to happen before we get to some kind of conclusion for the veteran. This is what they're hoping it can look like here in the next 30 to 45 days. It rolled out on the 2nd of April for all veterans. This is what they're hoping it to look like. Okay? But like I said, this is what it looks like right now. It's quite a bit of information to go through, and I apologize. If you want more information on it, if you're a veteran who wants to consider an appeal, and that's any veteran who has had a denial or a rating within the last 1 year. Okay? The RAMP election form, some veterans in here, you may have gotten the election form. That is a part of the Appeals Modernization Act. Just saying that, hey, there should be another way that a veteran can have an appeal heard without having to wait 4 or 5 years. And this is the way that they're going. Okay? Pretty much it just says a supplemental claim. A supplemental claim is when a veteran is denied and they, oh, by the way, I've just found some more records, put it together, and you send it back to the VA with that evidence, and they can re-adjudicate it. We used to call them reconsiderations. Or you can have a higher level review. That means the veteran and the veterans counselors truly believe there was a mistake in that ruling, where a senior VA representative will then take a look at the original file. Nothing else. You can't send anything that's new. The original file to a senior representative to see if they can overturn that. Okay? So these are what veterans are seeing now. As you can see, there's a barcode there, that little QR code. That just flags it in the VA system as a RAMP election form. Okay? Food for thought. I'm going to go through these bullets because they're very important. If you don't take anything else away from this period of instruction, you want to take these things. Benefits are awarded based on either the application date or the date of eligibility, whichever is last. So let's say, for instance, a veteran wants to file a claim for their back condition. They come in today and want to file that claim, but they don't have a diagnosis. Well, you don't have a diagnosis, you don't have a claim. So there's no need in us doing anything until you get that diagnosed condition. Same veteran, let's say they want to come in and file for the knee. They have documentation of the knee injury, just never filed that claim. We would then file the intent to file along with the 2122, gather any other medical evidence that we need, and then submit the application. So that would fall on the date of eligibility or the date of application, whichever is last. Okay, so it would be effective the date of this application. Develop your claim before submitting a formal claim with an intent to file or informal claim. You would have 365 days from submission to finalize your claim. So again, no need in rushing trying to put something forth. We just need to slow it down, figure out a plan, submit the intent to file, get everything together, and then send it in at once. Okay? Very important, this third bullet. All of our body aches are not associated with military service. It just happens. okay? Your bad back, your bad hips, okay, more than likely there's something going on in your service, but you know, you can't put everything under the sun that's wrong with you on the service. It's just a slice of time. Whether you serve 2 years or 30, you're still not going to have everything linked to service. I'm very fortunate working in heavy weapons. I don't have any hearing issues. But you have some veterans who only shot on the range for 2 weeks, and all their hearing is shot. I mean, you just have to sit down and realize, okay, are these things that are truly related to service or they're not? Okay? And that's just being honest with one another. You also want to read all your decisions to avoid continuous trips to the well. Every other month there's something different. You get that one granted, well, what about this issue? Well, what about this issue? We need to slow down, okay? Attend your medical appointments. If you have a knee brace because you're service connected for a knee issue, you should have it on. If you have a back condition, you should have your back brace on. We get veterans in here that say, I was prescribed a walker because I'm having a problem. Where's your walker? You walked in here, oh, all right. The spouse will say he doesn't use it or she doesn't use it. You're really not that bad then. You know, you're getting in your own way. And we joke about it in the office, but it's really serious. You know, if you're prescribed that walker or cane, use the walker or cane. Utilize your veteran advocates in your post, fraternal organizations, and the Manatee County Veteran Services prior to putting pen to paper. Okay, those are just some major food for thought, folks, that we see on a regular basis. Renee, Jack, or Jeremy, you guys want to add anything to that?
Not yet.
Okay. So, I mean, these are just some things that we see on really on a daily basis. And if you don't take anything else away, this slide, we can print it out and give it to you. Because if you follow these rules, we're halfway home. Okay? Questions?
Going back to one
Yep.
of the slides. It's mentioned about, you know, eligibility for VA medical services. The income eligibility requirement, I believe, I understand what I was told, is waived for Vietnam veterans and sort of in those states. But I was also told that if you were in the Navy, you didn't serve in country, and then you're not eligible. What is the right?
His question was, if you could show that you're a Vietnam veteran, the income requirement would be waived. On the surface, that is 100% correct. Unfortunately, we have some veterans who served in the Navy and even the Air Force that may have been there for a short period of time and there's no records, or those veterans that served on ship and they're considered blue water, well off the coast and not affected by Agent Orange. What about those veterans? Unfortunately, those veterans cannot use that as a waiver of not showing their income. Okay, we would first need to develop and see if there's any other documentation we can use that puts the veteran in that kind of a category. And if not, we need to look at something else to either get them service qualified or hardship. One thing about VA healthcare, if a veteran doesn't meet the criteria because of a special category such as these, or the income, there are catastrophically ill veterans who can get enrolled. The VA can help take care of them. And those veterans who are now facing financial hardship. So let's say, for instance, you had a veteran who was making $80,000 a year, loses that job, struggling with their mortgage, getting ready to hit eviction, they have no health care. We would then submit an application for financial hardship, and the veteran is enrolled, the veteran's taken care of until that situation changes in their favor. Okay? But we don't discourage any veteran from applying to the VA because, one, we don't work for the VA and we don't make those decisions. We can just tell you based on your scenario, this is more than likely what's going to happen. But any of those scenarios, if it's not yourself, sir, or someone you know, still sit down with us. There's a number of things that we can talk about to get you where you need to be. Okay? Yes?
I'm right on the boundary of Sarasota and Manatee County, but can a Sarasota resident get Manatee County VSO help? Or does it have to be?
Well, and the gentleman's question was, if he lives in Sarasota, can he use the Manatee County office? Sure you can. We encourage you, though, to use your county reps. Every county in the state of Florida has an office just like ours, and it's really their responsibility. That's how they really can show the Board of County Commissioners or the city, depending on what kind of makeup they have, that their job is worth having. If you're not using them on a regular basis, they could end up getting cut. But we have worked with veterans from other counties in the state, worked with folks in other states altogether, all the way out to California, because it's just, one, we're easy to get a hold of. Two, they may be coming to this area and this is where their loved one is. Or three, unfortunately, they're not getting the services that they need. You know, but we would always encourage a veteran or their veteran's family to use the services in your community. And we have the contact for all of them. Anywhere around the nation, we know who they are. Yes, sir.
I wanted to take another look at that sleep apnea.
Okay.
Is that covered? Because I came down here from Louisville,
Mm-hmm.
and I had a VSO up there that said it wasn't covered.
Covered as far as healthcare or disability?
Well, if you have to use that thing all the time, you know.
Mm-hmm. So you're asking,
you have sleeping problems.
So you're sound like you're asking about a disability claim.
Yeah.
All right. Well, sleep apnea, you know, if a veteran is diagnosed with sleep apnea, they can be rated up to 50% for that, but you have to get service connection. So no one in a VSO's office can ever tell you that you are not eligible for it. The VA has to make that determination. Now, if you've been out of the service 30, 40 years and you just got diagnosed, we need to do a little homework to see if you had those markers of having sleep apnea way back when. Normally it comes from lay statements from family members and loved ones who have known you to be snoring, having problems sleeping, and then we work our way back to the diagnosis. So it does take a little homework, but not impossible.
It helps if you have people that you were stationed with or that you served in the military with who can also write you lay statements as to those breathing problems while you were in.
Yep. When is the first time that you realized you had sleeping problems? You know, being clinically diagnosed is extreme. You know, something had to happen to have you go in and get that diagnosis. But if you've been married, let's say, the entire time, and the spouse has kicked you out of the room because you're snoring all the time, your buddies who serve with you say the same thing.
Well, that's not only a snoring issue, it's that you stop breathing.
That is correct. Unfortunately, I've been diagnosed with it. So yeah, it's the thing that you really can't diagnose yourself. You have to get a medical diagnosis, and also on the merits of itself, you also need to have a lay statement and documentation that says if the veteran has had these types of symptoms over the years, it should have been diagnosed back here. Okay, so if you don't have anything in the middle, there's not a whole lot you can do back here, but not impossible. Okay, and that's going to be like any other claim. When we talked about the continuity of care, if you've been seeing clinicians ever since your discharge for these migraines, but never filed it, you can show the history of these problems closer to your discharge. The further away we get from your discharge, the harder it's going to be, unless you fall into the Agent Orange category, contaminated water, and unfortunately the ALS categories, where all those things, you've removed that provision of having to show. But it's not impossible. I had a veteran who served with me. He's been out for 15 years, just got service connected for sleep apnea and diabetes. Because within his service records, it showed he had all the markers, but he was never diagnosed or prescribed any medications. He had really good clinicians on the outside that looked at all that information and says, well, here you had elevated, blood sugar levels, or here you went in complaining of not being able to sleep, insomnia, those types of things. It's a history that you can show. All right? Any other questions? Yes, sir.
You have medical conditions which you believe may have been started when you're in service or aggravated service. In my case, bad back. But I don't know how to connect the dots to say, here it either originated there or was made worse there.
Mm-hmm.
I don't think I can connect the dots on a documentation basis to make that point.
Well, you may not, but here's the things that we talk about first. We first want to get rid of anything that may have happened before service. So if you've never had any history of a back injury, that's one check mark out of the way. The next thing we always ask is, what did you do in the Marine Corps or the Army or the Coast Guard? What did you do as an MOS? Is that MOS more than likely going to cause these type of injuries to your back? If yes, then we just go to the next step and start doing some research of our own. And then, of course, obviously speaking to the clinician who sees you today. Can they provide any additional peer-reviewed medical documents that would support that? So again, that's something we would always encourage you to come into the office and have a conversation with us, and we can help you pick up on some of those things and figure it out.
Thank you.
Next question. Ed, what you got? Right? Okay. Well, gentlemen and ladies, we appreciate you coming in and spending some time with us this morning. I'm not going to get to the next slide in time, but next week, Renee is going to be talking about the VA pension program, and that's a benefit for our low-income veterans of war periods, and also those veterans who are now looking at long-term care who also served during a war period. That does not mean in the fight itself, but you had to be on active duty at the time of an active war. So it's a great benefit. A lot of folks just aren't aware of it, and I can guarantee you every veteran that gets awarded that through our office and around the state, it's a blessing, because you're talking about long-term care. That's anywhere between $1,500 and $5,000 a month on average. And knowing that the VA has a benefit set aside to help you take care of those things is a saving grace. So again, I appreciate you coming out and spending some time with us this morning. If there's anything that we did not cover, you want to have a conversation with us, we'll be here for some time, or you can make an appointment out front with Sue to come back and see us one-on-one behind closed doors. So we appreciate it. Thank you.